not working in Italy right now, and
Well,
they have a single-payer system.
well.
Now, with regard to what else I would do, the fact is that we're in a position where I would bring together the leading experts in the world. Instead of doing this in the United States, instead of doing this piecemeal, sit down and do what we did before with the Ebola crisis. What is needed? And have one voice, like we did every day we met in that crisis in the Situation Room, so we lay out overall for all the nation what the best proposal is and how to move forward. In the absence of that, governors are making some sound decisions. They're doing the best they can by going out and getting the healthcare experts in their communities and their states to move. But it should be directed from the White House, from the Situation Room, laying out in detail like we did in the Ebola crisis, and we beat it.
Thank you. Senator Sanders, your response?
Well, first of all, the dysfunctionality of the current healthcare system is obviously apparent. As I said earlier, there are people who hesitate to go to the doctor. You're going to have a maze of regulations. Well, if this is my income, if that's my income, can I get it? Can I not get it? Clearly, we are not prepared, and Trump only exacerbates the crisis. When we spend twice as much per capita on healthcare as any other nation, one might expect that we would have enough doctors all over this country. One might expect that we would have affordable prescription drugs. One might expect that we are preparing effectively for a pandemic, that we were ready with the ventilators, with the ICUs, with the test kits that we need. We are not. And bottom line here is, in terms of Medicare for All, despite what the vice president is saying, what the experts tell us is that one of the reasons that we are unprepared and have been unprepared is we don't have a system. We got thousands of private insurance plans. That is not a system that is prepared to provide health care to all people. In a good year, without the epidemic, we're losing up to 60,000 people who die every year because they don't get to a doctor on time. And clearly this crisis is only making a bad situation worse.